this education documentary series we're doing is going to be really focused on the full mouth replacement implant, all on X therapy that's out there. And I've learned in the dental world, bone is gold. You never get it back, is what they said, which is crazy. I think you can, but you know that they have to, for the all on X, they have to extract your teeth, grind down, remove some of the bone for clearance, and then they have a foundation and they zip in 4 to 8 implants, and then they put on a prosthesis, and you heal for typically 4 to 6 months. And now you have osteointegrated, because of the titanium integrates with the bone, new teeth, if you will. And so when you and I have been talking and thinking this through, you really came through some unique ideas that I'm excited for you to, for you to share with the dental community when they're ready to be shared. I know there's some that you're working on that are pretty proprietary right now.
I think they're only a few weeks away. We're creating a bone paste that has the growth factors in it. And I wasn't aware that it was a 4 to 6 months recovery. I promise you that it'll be a 6 to 8 week recovery when you combine these growth factors with that bone paste.
For full osteointegration.
Yeah. I had an example, and he's a well-known neurologist from UCLA, and he'll be happy to tell you the story. He also likes to ride a Harley. So this guy is super important to me. He's the basis of my exosome that is going to rewind aging. So he fell off his motorcycle. He had a little accident. Somebody pulled out in front of him, and he broke something like 9 to 13 ribs, shattered his clavicle, broke his ankle. And so the next day I sent him 10 vials, which is about $10,000. He took 5 of them. Within 3 weeks, and he'll tell you this, he had no more pain from his ribs, which you know how long that usually takes. It was painful. And his ankle had healed. And he has the images to prove it. So you may want to speak to him at some point, but that's what I'm trying to say. The recovery time that you're seeing, inflammation hurts recovery time, right? Bone can't grow as quickly if there's inflammation.
Sure.
So if I'm telling you that we can both instantiate the growth of bone and stop the inflammation, that's why you want to pre-treat, that's why you want to post-treat, and I think you'll cut down those recovery times. And that's what the dental community should be saying to the patient. Like, you want the outcome, but you want the patient's life to not be disastrous afterwards either.
Right.
If you could remove a wisdom tooth with no pain and a 6-day recovery, 5-day recovery, then why wouldn't you want to do that for them?
Right.
And the patients may be willing to take the upcharge to know that they can have that.